Hello, I'm Dr. Kent and welcome to the second video about Simba the Yorkie. Now she is 14 weeks old, so it's time for the second vaccination. And I have some good news that the poop sample we sent away last time, it showed no parasites, so we don't have to deworm her before the vaccination. Common invaders of the digestive tract in dogs and cats include parasites such as Giardia, Coccidia, Cryptosporidium and worms like whipworms, tapeworms and hookworms. Roundworms you might see if the dog or cat has, if they vomit. Then you can see small living spaghetti in the vomit. And the tapeworms you might see, they look like sort of flat grains of rice in the poop or around the anus of the dog or cat. And if you don't have the possibility to send a fecal sample to lab like we did, I think once or twice per year you should drop off a sample to your vet to have a test done to see if your animal has parasites. Because like antibiotics, you shouldn't use dewormers indiscriminately, because worms and parasites can become resistant just like bacteria can. So don't use them if you don't have to. As you might remember, last time she had an ear infection and we treated her, but now it's well, no smell and no irritation. And remember, we didn't use any ear drops with antibiotics. We just used this with a Tris EDTA chlorhexidine. Antibiotics are seldom needed in ear infections if you're not unlucky to have a dog with a Pseudomonas infection, because they are almost impossible to treat. They are often resistant to nearly every antibiotics. I would urge you to clean your dog's ears on a regular basis, especially if you have a dog or a breed predisposed for ear infections like Spaniels or Newfoundlands with very heavy hanging ears. Maybe once a week in those breeds, but don't use water or any strong harsh solutions. Use a mild ear cleaner like we did. In the first video we showed how to clean the ear canal of dogs, so look at the first video at this time. You can see how you do it. And remember the ear canal with the 90-degree angle that you should straighten out so the ear cleaner can get all the way into the tympanic membrane, and also fill up the ear canal. Don't use just a few drops like people often do. Fill up so it's full with air cleaner, massage it quite strongly, then wipe it off with some cotton. So now it's time for vaccination. In Sweden we vaccinate at 8 weeks old, 12 weeks old and then at 1 year of age. And then it's every third year, except if you want to vaccinate against para-influenza, which is a part of the so-called kennel cough. Kennel cough is a mixture of different respiratory viruses and bacteria, but it's not dangerous. It's like we get influenza. They have cough for a week and maybe fever for a week, but if they rest and take it easy, it passes almost always without any treatment. And the reason why we give a second vaccination at 12 weeks of age or older than 12 weeks of age is because if the mother, the bitch, is very well vaccinated, she has antibodies, of course, and they can pass via the milk to the puppies, and they get so-called maternal antibodies. And if you vaccinate a puppy when it has maternal antibodies, the vaccine won't work properly. So that's why we vaccinate at 12 weeks of age, because then the maternal antibodies has disappeared or at least decreased, so the vaccine will work until it's 1 year old. And I would urge you not to over-vaccinate your dogs or cats. remember it's a very lucrative business for both the drug companies and the veterinary clinics to vaccinate animals, so don't vaccinate against diseases that's not necessary. And I think when you vaccinate, you trigger the immune system in a growing animal, and that might play a role in the surge of allergies in both dogs and cats, because the immune system might be sort of hyper-reactive against other things. And also make sure the vaccine do not contain aluminium or thimerosal, that's mercury. Okay, now it's time for the vaccination, and then I usually give them some treats to chew on, then they don't feel much when you vaccinate them. So there you are, and have with the vaccine. I'll give it. Oops! So that was all for today. I hope you liked today's video, and as we say in Sweden, hej då!